documentation in musculoskeletal physiotherapy. The talk will be delivered by Dr. K. Ganesan, sir. He is very well known in the annals of physiotherapy education all over the country. But just to mention for those who are joining for the first time or who don't know much, I would like to tell Dr. K. Ganesan, he's a sports physiotherapist with more than 2 decades of experience in the field. He's a certified instructor in Pilates and kinesiological taping. He has conducted 200 plus workshops all over the country on Pilates, taping, balls, bands, tubes, and fitness. He's currently heading the Department of Physiotherapy and Sports Medicine in Ortho-1 Orthopedic Super Specialty Center at Coimbatore, Tamil Nadu. Sir has also served as a team physiotherapist for Chennai Cheetahs for the World Series Hockey and Chennai City Football Club League football teams. He has been associated with various sports clubs, eminent and elite athletes, individual sports persons at grassroots level and as well as to the top professional levels. He has served as a chairman board of studies also and also as a board member the Department of Sports Sciences at Ramachandra Medical College, Chennai. He was chairman of board of studies at Pandit Ravi Shankar Shukla University, Raipur before also. His key area of work is in sports physiotherapy and musculoskeletal physiotherapy with special emphasis on ACL, shoulder rehab. He is a clinician by hand and he is an academician by heart, because we know very well that going through his illustrious career and experience, he always loves to learn and loves to share his expertise and knowledge with all of us. So this is our privilege and honored to welcome again Dr. K. Ganesan on this forum on behalf of Team Physio Inculcators. And again, it is a coincidence that today 2 months are being completed when the Physio Inculcators started their first session on 15th of May. The session on 15th of May was taken by Dr. Himanshu Sharma as the resource person. And since then, he has been serving as the host for all the webinars. And today is 15th July. Team Physio Inculcators has conducted around 66 webinars in these 2 months without any break, with 2 panel discussions, 1 symposium on cancer rehabilitation, and planning some other more events in the coming few days. So our heartfelt gratitude to all of you for joining all of us. It is our just a humble effort to create knowledge sharing, and people like Ganesan sir and all the resource persons have been joining out without any interest other than sharing the knowledge. So hats off to you and heartfelt gratitude to all the resource persons. Today is also the World Simplicity Day. So 12th of July is celebrated internationally as World Simplicity Day, and it is a great apt day for introducing our today's resource person. He is a very simple and humble resource person, Dr. K. Ganesan, because he always loves to learn and loves to share his knowledge. So without wasting much of the time, I would like to welcome Dr. K. Ganesan on the board. Heartiest welcome, sir. Over to you, sir. Thank you.
Good afternoon, everyone. Thanks, Harsh, for inviting me again. And Himanshu, again, a great job. And nice to know that this forum has been doing so well. And I can see the quality of the work and the number of speakers and the topics what you have been doing. So nice to know that I have few of my friends are also here. Hi, Jaban. I think Ramakrishnan is also there. Amrita is there. So nice to again catch up with you guys. So I think I can do my screen sharing, right?
Yes, sir. Yes, sir. Yes, it's visible, sir.
Okay, it's visible. Okay.
Yes, sir.
So today's topic of mine is on exercise prescription. I've tried to make this topic a little interesting from the clinical perspective, and for a revision point of view, it will be there. So I hope I can deliver what I'm planning to put on. Okay, so this is something of a quote which I use in all my teachings to tell people that the general perception with the medical community as well as the patient community is they always want to find which is a good exercise, or is this the exercise for weight loss or for my injury and all those things. So understand that there is no good or bad exercise at all. It's only the right choice and the right form of exercise. Now, some people are biased with gym, so they don't do yoga. They want only to do the gym-based exercise. So these are few perception of what people look into, thinking that how an exercise format is done. So understand that there is no bad or good exercise. It's only the selection of the exercise and how you are going to perform. Okay, so exercise prescription. Now, when do we prescribe exercise? Now, you need to know why you are going to prescribe an exercise and what is the outcome you are going to look at. Now, when people do research, they say your effort and outcome has to be there. So when you plan an exercise, you should know why you are going to give this exercise and what is the outcome you're going to look at from this. So if you can tell me why you are doing an exercise and why it is beneficial, then it is a good exercise. That means what? As a therapist, I am going to be aware that why this exercise is done and what is the benefit it is going to be done. So in our profession, exercise is mostly prescribed for pain management, for muscle activation, to restore passive range of motion or active range of motion. When you want to teach somebody a good pattern of movement or the correct way of movement, then strength training in rehab. So this is clinical based rehab strength training, and then fitness and strength based rehab is for something who is going into a sports or going to be gymming or doing any other activities, and then becomes your sports specific. So these are your, yes.
Sir, excuse me, sir. Good afternoon, sir. Sorry to interrupt you. Sir, I would like to request you. I think your screen is not in the full screen mode. Can you please, because we can see two slides together. One is smaller slide, one is bigger slide. I think next slide is also visible there.
Okay, just a second.
Yes, sir.
Just a second, just a second.
Okay, okay, no issue, sir. I think you are trying resharing.
Yeah.
Okay.
Can you now, can you see one screen? Himanshu?
Yes, sir. One screen is there now. Now that is absolutely fine, sir.
This is okay, fine.
Yes, sir. Thank you, sir. Thank you very much. And again, apology for interruption.
Oh, not at all. So the basic prescription for exercise is these are the things. So why do people need an exercise is basically to be physically active and get about their functions and perform their activities. So if you look at our range of motion or movement of people for physical activity, first thing is they need to have activation. So that is basically the required muscles to function. Then passive range of motion, active range of motion, flexibility, strength, and all these components will help you in a functional pattern. So our initial classification of what I said exercises can be that these can be exercises where in our rehab setting where it is more of pain, muscle activation, joint stiffness, weakness, and movement pattern. Whereas when you go functional and strength, it can be your strength training, functional, and sports specific. Now, what are the principles to consider before you plan an exercise? So first thing is we need to know what is the primary function of the muscle. We all know that muscle has got a primary function and a secondary function. So we need to know what is the primary function. So it's basically the primary function you want to train or the secondary function you want to train. Then know whether it is a one joint muscle or two joint muscle. Because if you're going to have one joint muscle or a two joint muscle, then there is going to be an active and passive insufficiency coming. And if you see, all our joints in our body will have a one joint and two joint muscle. So that is going to differentiate and make our alterations in the range of motion what is expected. Then your range of motion will have to have individual consideration. That means some people can be hypermobile, some people can have stiffness, or some people can have a bad posture. So that time you cannot go with your conventional thinking, okay, there is the range I need to come up with. Then if you know the nerve supply, it is still very good so that you know whether there is any nerve involvement in the motor component. Then the amount of pain if they have, what position you are going to start your exercise. Would you prefer him to start at a supine lying, prone lying, side lying, sitting, standing? Then what you want to do as a open kinematic or a closed kinematic chain exercise. So before you start, you need to take these into account. Then what are the biomechanical principles you need to take into account? So axis and plane is the basic definition how we look at our human body movements. But once you are going into functional, we are not going to be very precisely doing a axis and plane, but we are going to do variations. So if you are going to do a shoulder flexion, which is going to be on a frontal axis and a sagittal plane. So you can have variation that if he is going to do at 45 degrees, that is going to be slightly off the specified axis and plane. But that can be a progression. Then we need to know levers. We have the first order, second order, and third order lever, and they are fundamental that muscle can take, or the mechanical advantage that movement is going to have. Now, how is this going to help me in exercises? How I can progress with my resistance. So when I add resistance in short lever, long lever, how it is going to load the muscle. Then need to know the end feel when you assess, because as an exercise program where you are trying to go and do a range of motion exercise where you might have to do some mobilization or active mobilization exercise program, the end wheel is required, and tissue tension. Now tissue tension is something we have to teach the patient what they need to perceive, because that will give them an indication that they are going to exercise in the right way. Now, sometimes a tissue tension is perceived as pain for the patient. So we need to tell them how do you differentiate. Now, when you are going to try and increase the range of motion, the patient will try to feel more of pain. He will tell, I feel pain. So what we can explain them is when you do a calf stretch, there is going to be a pain on the calf muscle, but that is going to be followed by a stretch feel coming from the tissues. So we need to tell them differentiate, because at the phase when we are going to give them exercises, with where there could be pain. So this differentiation will have the component how the patient will be able to progress the exercise, knowing which is a good pain and a bad pain. So exercise principles, what all we need to know. What is the aim of the session? So when you have the patient with you at your session, you need to have a specific aim. Okay, what am I going to do? I'm going to just assess, look for the quality of the movement, or I'm going to look at how he can do the strengthening exercise. So you need to have that. Then whether your session is going to be therapist assisted or equipment based, and whether you're going to give exercises which is based on short lever or long lever, and what are the assistive devices you might need for this patient. So you might need to use a cane, you might need to use a towel, you might need to use a band, a CPM machine, those things. Then coming on to 1RM and 10RM. Now this is basically required when you go on to the strength training. So when I go into strength training, I will explain this in little detail. Then we need to plan the frequency, intensity, and time. This is basically a principle for fit principle where we give for exercises how much days they need to do, intensity, and time. So I'll go that little later. And quality of movement. Now, defining quality of movement is like when you do a particular movement, you should be able to do it at the particular axis and plane without any trick movements, and recruiting the appropriate muscles without using any abnormal pattern. So that will be your quality of movement. Then comes your documentation. So how you are going to document your exercise session in terms of your frequency, notes, key notes like, okay, this is the mistake you're doing. Those things also has to be noted. Then comes your review. You need to plan when do you call your patient for review. Okay, so we have this guy trying to do a exercise. So I am asking, what is he strengthening? Now the answer will be that he is strengthening his hip muscles. That's the gluteus maximus. Okay, now consider stability and mobility. So whenever I do my exercise plan, the first thing I try to do is, okay, what am I trying to get better for this patient? Whether it is the stability or it is the mobility. Now this is the basic fundamental what we want our patients from. Whether he needs to improve his stability or mobility. So when you move it, you want to make sure that yes, it is deeply put it on the ground and it can stay. So stability based exercise have to be graded by mobility. So if I can push my axe about 1 feet, it can be. So that means what is flexible for 1 feet, but if it goes to 3 feet and feeling to things, so mobility when add stability, it also option. Now joints work on single plane or 1 degree of movement, we call them. Some joints work on 2 degrees. So we always have to plan our exercise. We start something on the safer one and then progress to the other sides. Then comes the open kinematic and closed kinematic chain exercises. Now, open kinematic chain exercises are mostly exercises more required on the lower limb because upper limb. Open kinematic activities are more shoulder, elbow, wrist based activities. Now, if I have a patient with wrist, elbow, or shoulder